So my thoughts on red light, and obviously, I've read all the science and the trials and, talked to a lot of people in the industry about red lights, is I would not purchase one personally, and I would not recommend my patients purchase one. And here's why. Number one, both my parents are ophthalmologists, and I do a lot of lasers around the eye, and I'm very concerned about my patients' retina, cornea, all of these things. And there have been reports of those red light masks damaging the retina.
Today I'm with Dr. Kat Kesty. Thank you for being here.
Oh, thank you so much for having me, Gracie. This is really a privilege.
Yay. So I was scrolling on Instagram. You guys know that I moved to St. Pete about a little over a year ago. And I don't have a dermatologist in the area. And I was like, okay, let me just see if I can find a derm. And usually I'll have a friend that makes a rec. But your page came across my popular page on Instagram. And I saw some of your before and afters with your laser treatments. And everything just looked so well done and so natural, and I was like, oh my gosh, okay, I'm gonna book an appointment. And I think I got an appointment a few days later, and I was so excited because I've never had a laser treatment. I was really nervous, but I saw your before and afters, and I was like, oh my gosh, this is incredible. So then we had our consultation, and you and I just really hit it off, and I was like, hey, you gotta come on the podcast. The girls are gonna love you. So thank you for being here.
Yeah, thank you so much for having me.
Yeah, I want to dive into your background because during our appointment, I was talking to you about some of my skincare products and some of the things that I use, and we talked a little bit about misconceptions, so I'm excited to get into that later. But I want to know just about your passion for skincare. I know you have sisters that are both in medicine, and you have your own practice, so just give me a little detail on your background.
So the journey to become a dermatologist laser surgeon for me started when I was a kid. My parents are both physicians, so I knew I wanted to be a physician, but I didn't know what kind. Mm-hmm. In college, I landed a really cool summer research job doing research in theoretical chemical physics, which is about as nerdy as you would think it is. And I really, really loved theoretical chemical physics. I was studying chiral molecules and quantum mechanics, and I got really into physics, and I was like, maybe I'll become a physicist and do that. But I decided I like people. I don't want to sit in a lab, so I went to medical school. In medical school, I discovered dermatology. Just one random day, I walked into a derm clinic with a friend of mine, and she wanted to be a dermatologist. And so her passion for it kind of translated into my passion for it. Once I spent a half day in clinic and I realized how many diseases dermatologists know about. And I was like, wow, they're pretty smart. They know a lot. They do a lot of things. They do procedures. They do clinic. They can do surgery. They see the full spectrum of patients, all the way from newborn babies in the NICU, all the way up to kind of your sweet 95-year-old grandma with skin cancer. So I loved the breadth of dermatology. And then I came to lasers because I thought, well, I do have this love for physics. I love the science of it. And what can I do that's going to merge the science with dermatology with, I love my patients. I love talking to patients. I love the social aspect of it. And so I kind of came to this world of lasers and cosmetic dermatology that way.
Yeah, what I love too is the info that you share, and even the short conversations that we've had, you really focus on science-backed skincare and just the education aspect of everything. So I want to know a little bit about your skincare routine. I know that you focus on just fewer products.
Yes.
I think during our appointment, I was like, oh, well, what skincare do you like? And you're like, you named two or three products. And I was like, okay, we need to know all the details. We need to know your holy grail. So just walk me through your skincare routine.
It's going to be surprisingly simple.
We love that.
To me, a skincare routine is sunscreen in the morning, a retinol at night a couple times per week if you can fit it in. And if you live in a dry climate, or right now in Florida it's a little bit cold, so I'm adding in a moisturizer to that. But
okay, so in the morning you use just SPF.
Well, so I use SPF, but the products that I like are going to be one application, so it's technically an SPF. But now with the newer skincare technology, my SPF has, obviously the sunscreen in it. It has a moisturizer, and it has a little bit of that kind of antioxidant protection in it.
Okay.
And I love that about the newer skincare products. The companies that are doing the research to back it up, they're putting your 5 or 10 step skincare routine into one product, which is what I tell my patients. Now is the best time that we've ever had to want good skin, because it's the easiest that it's ever been. Because instead of doing 5 or 10 steps, now you're just doing one in the morning and one at night. And most people can do one thing in the morning, one thing at night, a couple times a week, the night one.
Yeah, and I'm not somebody in the morning who wants to apply like 10 different things to my face. Honestly, at that point, it's so hard to know what's working, right?
Correct.
And then like the last product you're putting on your face, you've got like 9 layers of skincare underneath. I'm like, is this really soaking into my skin the way that it needs to be? And so I love what you just said about some brands putting these 9 to 10 different things that you need into one product. Can you give us an example of a brand that does that you like?
I think there are a lot of them out there. You know, I like the Skin Better line. And again, I don't have stock in that company or anything.
Is this what you use in the morning?
My practice.
Skin Better?
I actually do use Skin Better. So I developed my own sunscreen, which I only sell in my office. Don't worry, I'm not going to link it. This is not a sponsored post.
No, we need the link. I'm going to have to buy it now.
You know, because I didn't really like the price point of the expensive companies. So, and, you know, I'm not Drake. I have friends in this industry. So I went to some of my friends who are cosmetic chemists, and I was like, make me a sunscreen, make me a moisturizer, make me a retinol that's the same quality, if not better, than these ones that are selling to millions and millions of people that I can, you know, private label for my patients. So that's what I did. So sometimes I'll use Skin Better. Sometimes I'll use my own kind of product that I developed for my patients. So,
oh, that's awesome. I love that you did that.
But I love what you said, Gracie, about the putting on 10 steps in the morning, or even putting on 1 step in the morning, right? Because the skin is our barrier to the outside. It keeps the inside, it keeps the outside. And the thing that I love about being a dermatologist is I have such respect for how complex the skin is. You know, there's 3,000 diseases that you can get in the skin, and that's because there's so many different molecules and proteins. You know, there are people that spend their whole life studying the dermal epidermal junction because it's such a complex thing. In dermatology residency, the first 12 weeks of residency are spent studying just the dermal epidermal junction. It's so incredibly complex. And so the thing to me about skincare, which I say to my patients, is if you're going to spend money on skincare, spend money on skincare that you know is actually going to do what it says it does.
And how do we vet those products? Like, how do we know when we're going to purchase something that it's going to do the things that it says it's going to do?
You can go to the website and see if they have research on it, published research. Or you can ask your friendly cosmetic dermatologist like me. That's a huge nerd that is going to have already read all the research. And, you know, we can advise you on that for sure.
So when it comes to vitamin C serum, like you were saying, so that's like you have antioxidant properties already in the SPF that you're using, so you're not like applying a vitamin C serum.
Personally, I don't because I'm also a little bit acne prone.
Wow. So do you not recommend vitamin C for people who are acne prone?
I, as a dermatologist, do not, because I have not found a vitamin C serum that I put on that does not trigger my acne. Wow. That's been my experience. And if you look at the data, that's also true as well.
Why do you think it's so heavily like marketed in the skincare space? Like everybody needs a vitamin C in the morning.
Because there's a little bit of data showing that vitamin C can help with some very, very superficial brown spots. And what happens in the skincare industry and other industries is there's a small little bit of data and people latch on to that to sell products.
Because you see so many vitamin C serums and it's like...
But vitamin C is a very unstable molecule. If you talk to a cosmetic chemist, which will actually be an interesting person for your podcast, if you talk to a cosmetic chemist, they'll say that it is so difficult to get a vitamin C molecule actually stable in a vial for more than a couple weeks. And then even if you get it, let's say you can magically produce this vitamin C that's stable, to get it on the skin through all those layers of skin to the dermis where it's going to have the effect is so difficult. Any vitamin C that you open that gets exposed to air is not going to work after a certain amount of time because you're just oxidizing all that vitamin C.
Wow.
So
what about if it's paired with lactic acid? Does that do anything differently or does that make it more effective?
It can, because the lactic acid is going to kind of open the top layers of the skin.
So if somebody wants to purchase a vitamin C, is there any brand that you recommend, or do you just think you should focus on buying the product that maybe already has the antioxidant properties in it?
If you want a longer skincare routine, then you can definitely buy a standalone vitamin C. But
like,
I
if
would
you
be
really
sure.
feel like adding the serum in and you want an extra product, go ahead.
Well, here's the thing, Gracie, and this is what I tell my patients too. A lot of women in general need more self-care. I'm very pro self-care. So if you're the type of person that wants to put on their really cute headband and spend 15 or 20 minutes in the morning and at night doing your 10-step skincare routine, do it. I'm not going to tell you not to do it. As long as those products aren't causing you acne or irritation or something else like that. Do it. I love that. 15 minutes twice a day for women, I'm very pro. Like, that's your me time.
Yes.
Do it. But don't expect the results of lasers and procedures and Botox from a skincare product.
Yeah.
It's just
like,
not
don't put
possible.
all of your eggs like in the vitamin C serum basket.
No,
it's not going to fix everything. But it's so true. I mean, sometimes you see people talking about, oh, this is like totally, got rid of all of my sun damage and all of which we're going to talk about lasers a little bit later. It's just not true. Like, there's no serum that's going to have the impact that a laser would. And
it would be nice. I would love that.
Yeah, it would be great. Less downtime, just easier, I also want you to talk about the importance of a proper skin barrier and how to protect it. I'm hearing a lot of people talking about, either products that can destroy the barrier or products that can improve it. So can you just talk a little bit more about that?
Yeah, I mean, the skin barrier is really important because, the skin is your barrier to the outside, and kind of supporting that skin barrier with kind of everything on the inside, getting enough healthy fats, protein, calories in general, exercise, all of that is going to help from the inside. And then from the outside, you want to protect it. And that's just finding a skincare routine that works with your skin chemistry, your skin microbiome. And we definitely do not want to do something so harsh that's going to damage that skin barrier, because signs of a damaged skin barrier would be redness, irritation. You can get acne, you can flare your rosacea, you can get perioral dermatitis. So you definitely want to help that skin barrier stay intact. And if you do have a problem, then, if you're getting any of those signs, you should really see a dermatologist to talk about kind of how to reverse that and how to keep that skin barrier healthy. So.
Are there any products that are, and I know it can vary from person to person, like damaging to the skin barrier?
It really varies person to person, and it's also the product and then how frequently you're using it and how much you're using it.
Yes. Of a product can lead to the disruption.
Yes.
And then what if somebody's wanting to repair that barrier? Can that be done through skincare products, or does that need to be done through treatments, laser treatment?
It depends on how bad it is. If someone has, what they think is early perioral dermatitis or, a flare in rosacea, my number one recommendation as a dermatologist, and this is of course in general, would be to decrease the amount of things that are touching your face. So, if someone comes in with their flaring their perioral dermatitis, maybe go back and see what flared it. Did I start a new product, makeup, shampoo, laundry detergent, all these things, hand soap, hand lotion.
So many things that it could be, but it's so true. All the things that our skin's coming into contact with that we don't think about.
Yeah, and we touch our face so many times during the day.
Yes.
So anything you put on your hands, you're putting on your face. But in general, I say go ahead and wipe out everything that you can from your skincare routine to something really, really simple. And sometimes I'll do something very gentle, like some plain petroleum jelly, and then just kind of the minimal skincare routine.
Okay.
So,
and I know you mentioned kind of some symptoms or some things you may notice if you don't have a strong skin barrier, but what does your skin look like if you do have a really great skin barrier?
A good skin barrier would be you can put products on and you're not going to be as sensitive to them. You could go get professional makeup done. You could go swim in a pool. Any kind of lack of redness or irritation or dryness would be a symptom of a good, healthy skin barrier.
Awesome. I also want you to go into detail about science-backed skincare and how it differs from skincare that is not science-backed. I talk a lot about toxic-free skincare products, and I know we briefly talked about beef tallow.
Yeah.
So can you just kind of go into detail about the difference between the two products and maybe what type of skin will be suited for each?
So to me, science-backed skincare means anything that the companies have done research on to prove. If it says it's going to build collagen, it builds collagen. If it says it's going to treat acne, it treats acne. They've done trials on patients, some more robust than others, to show that if I'm saying it does X, it does X. And here's, this trial that shows this. Now, your non-science-based skincare is going to be anyone in a lab or in their basement putting a skincare product
Or
and
their
saying,
basement.
hey, Gracie, this is going to get rid of all your wrinkles.
Okay.
And I think, I have a more balanced opinion because, we've talked about how I really do like beef tallow.
Yeah, I think
That's
beef
obviously
tallow's
not
great.
science-backed.
Yeah.
That would be more what we call anecdotal. So I've had patients, I've used it personally. I like it. It's not something that I recommend because I try to practice evidence-based medicine. But I have patients that come to me and they're like, I love beef tallow. Can I use it pre and post laser? And in my anecdotal experience, it's done really well. It's not a science-backed experience, if that makes sense. It would be more of an anecdotal experience.
I definitely love that you're open to both. I think it's so important to have that mindset and to be open to the different products because, like, you're right, some people do really well with products like that, and then some people do need the products that are, science-backed. So
Yes.
Are there any ingredients in particular when we're picking out our skincare that we should be looking out for that maybe will clog our pores or that are just an absolute red flag to you when purchasing skincare?
To me, a big red flag is anything that is known to cause systemic issues for people. Especially as women, I think about my own hormones and my patients' hormones a lot. And there are published studies showing that things like lavender oil and tea tree oil can cause something called gynecomastia, which is breast growth in men.
Wow.
So these things I personally would not put on my body or recommend to a patient because I like my hormones being balanced.
Yeah, regulated.
And I care about my patients. So, those things I would say stay away from if you can, because those are known to cause systemic side effects.
So lavender and tea tree
oil
are two ingredients.
Yes.
What about like the brand? A lot of the brands that we see at Sephora. Are there any brands that you feel like are pushing certain products or making those promises and they don't have any?
I would say that's a lot of them.
Yeah.
Yes.
You're like, the list is too long to share.
And to me, I'm such a minimalist with skincare because I see the studies about, and I have, people that work at companies that are patients of mine and friends of mine. And Gracie, before something comes to the market, they do trials where they put it on people's face and it shows up in their urine. And that to me is something that maybe consumers need to know more about.
Yeah.
Because
why is it showing up in their urine?
Because it's getting through to the skin. The skin is a barrier, but it doesn't keep 100% of everything out, and it doesn't let 100% of it in. So skincare companies now are working on how can we get this product into the dermis to have the effect without going systemically and having a negative effect. Yeah, so I'm a minimalist in skincare for that reason.
Wow.
So,
And is there any way to know which brands or which products will do that? Or
you can call the company and ask them, but sometimes they will tell you and sometimes they won't tell you.
Yeah, I can imagine a majority of the time they're probably going to be like, no, you're all good. Just keep lathering it on your face. Oh,
Yes.
gosh. I kind of want to segue into skin treatments and lasers. So when I first came to you, I showed you my legs, and you can tell them what exactly it was, because to be honest with you, I can't remember the name of it. But I've had these spots on my legs for, gosh, at least the past 5 or 6 years. They've been bothering me, and you start talking all about lasers and my brain just went like, oh my gosh, it's a world that I know nothing about. But when you were showing me the before and after photos, and when you start talking about them in detail and the benefits and the long-term results, I was immediately intrigued. But I think lasers in general, it can be scary for a lot of people because you do see the photos and you see the skin peeling off and you see the redness, and it's kind of like a trust the process moment depending on the laser. So I want you to break down the purpose of laser treatments. We can talk a little bit about those spots on my legs and kind of what you would do to treat that. But I know it can vary per condition. So for acne, anti-aging, dark spots, sun damage, wrinkles, volume loss, scarring, uneven skin tone, you have a laser for everything. So just give us the laser 101.
So laser 101, you can kind of think of it as a magic wand. And,
I love that.
Anything that you want improved, for the most part, a laser can help you. There's technology to help you with that. So, there are a lot of lasers on the market, And I think the hardest part as a patient and as a consumer is lasers is still an apprenticeship. If let's say you had high blood pressure and you were like, okay, I have high blood pressure. This is my blood pressure. I'm going to go to PubMed or Google Scholar, and I'm going to kind of be a Google doctor for a day,
Yeah.
And most likely you would land, and you could do enough research, Gracie, that you're going to find something that's very reasonable. If I told you you have 1 hour in Google, find a blood pressure pill and give me the dose because this is your high blood pressure, you could reasonably find a good treatment for you.
Right.
Lasers is not that way. It's still one of the true apprenticeships in medicine in that you have to spend time with someone who's really good at lasers, that has a lot of lasers, to understand the complexities of lasers so that you can go to a patient, or a patient can come to you and say, hey, doc, I want this. Can you do this? And you're able to kind of deliver on that safely and effectively. So that's kind of the laser 101. There's a lot of lasers out there. It is almost impossible as a patient to choose which laser is right for you. And that is because it's kind of an opaque area. And the best thing to do is to find someone who's an expert at lasers and have them kind of guide you through which lasers would be best for you.
If somebody had, acne prone skin, what would be the best laser for them?
The best laser for acne is going to be a combination. The trials on single laser for acne are very unimpressive, Gracie.
Okay.
And my favorite combination for patients is to do 2 or 3 different lasers per acne laser session with me.
And is this for scars from acne and people who both have active
Correct.
acne, if that's what you would call it? Okay, so it would work for both.
Yes, and one thing that is a myth out there is that you can't treat your scars if you have active acne.
Okay.
And that's not true with our newer lasers. I have a lot of patients that I'm treating their acne and their acne scars at the same time.
Wow, okay. I'll let you explain that process because I kind of jumped in, but I was curious because you would think that maybe the scarring treatment would be different from somebody who has active acne. So you do a combination of lasers.
Correct, yeah.
Okay.
Yeah, and sometimes I'll do a peel at the same time.
Wow.
And the thing about lasers is that 1 + 1 does not equal 2 with lasers. The skin is such a complex organ, and then you add in the complexity of the physics of lasers, and 1 + 1 doesn't equal 2, because you'd think, hey, I'm going to do 2 lasers on you or 3 lasers on you. Let's say you came to me with acne. You'd be like, oh my gosh, it's going to be triple the downtime.
Yeah.
But actually, there's a lot of studies showing that laser A plus laser B is less downtime than either laser A or laser B together.
What are the specific names of those laser treatments, if you don't mind me asking?
Yeah, so we can go by wavelength.
Okay.
The best wavelengths for acne are going to be 532 and some of the 560 on the intense pulse light or the broadband light.
Okay.
So-
And then what about a laser treatment for just general sun damage or dark spots? What's the best laser treatment for that?
So that's a good question. Brown spots, there's so many different types of brown spots, but I would say if you're going to have me pick one laser, my favorite would probably be erbium. It's 2940. It is a resurfacing laser, but it's a very customizable laser to the patient. So I can do one treatment on you and you stay in your house for 7 days and it looks like a fire extinguisher blew up in your face.
Oh, no.
But at the end of 7 or 10 days when you're healed, you look 10 to 20 years younger.
And is this where the skin completely sheds and peels off?
Yeah. Or we could do, for my younger patients who are just on more of a maintenance regimen, we could do a fractionated erbium where I'm not treating the whole skin. I'm just treating, a percentage, maybe 5-10% of the skin. We do that treatment once a year. You look a little bit red for about 24-48 hours, and then you just kind of don't age. Like that skin doesn't
just stop
age.
aging.
So yeah.
I love that. Okay. I'm gonna have to book my appointment right after we finish this podcast. I know it depends, laser to laser, like the downtime, but generally it's best to, I'm sure, stay out of the sun. You don't want to pick or pull at your skin. You're not probably putting product on your skin.
Just
right?
moisturizer.
Just moisturizer.
Yeah.
Okay, because I've seen some photos that are for whitening, and I feel like that's what scared me the most about lasers. You just don't know what to expect. And then I've also seen, and this might be microneedling, I'm not sure, but people have actual scars and permanent scarring from the laser, and you can almost see the patch.
Yes.
Why does that happen to certain people?
Wrong laser, wrong settings. Very, very common out in the community. So people are choosing, there's so many different lasers and wavelengths. And so even if you choose the right laser for the right patient, you have to go and do the settings.
Okay.
You have to know the settings for each laser.
So you change those settings based off of the patient.
All the time.
Yeah.
Yeah. I mean,
So
I've
it's not like
probably
a
done
one-size-fits-all.
10,000 laser procedures in my career, and I probably have not had the same laser, same settings in that 10,000 patients. So everything is super customized to the patient on that day.
Okay.
So
And what would you say is like the most popular laser treatment that you do, or the one that you feel like is the most beneficial in terms of just like giving you that like youthful glow or radiance, or just like the best overall results?
the most popular treatment that I do in my practice is going to be something that I call laser eye rejuvenation, where I take all the skin around your eyes and I do a fully ablative laser. And sometimes I'm doing it on the face too. If they want, some jowl work, or that they have smile lines, or, they want a little brow lift with the laser. And then that's going to be your kind of 4 to 7 day downtime laser, but it's going to treat the crepey skin, the fine lines, these wrinkles. It's going to increase the lid show, which is, pulling
So if
this
you have
up a
kind of
little
like
bit.
like
The
loose
hooded
skin
brow,
or
yeah.
hooded, it kind of gives you that lift.
Yeah.
And what about, using lasers for your wrinkles versus Botox for your wrinkles? Is there one that's more beneficial? Do you see more long-term results with the lasers for your wrinkles than you do with Botox?
Yeah, this is a conversation that I have with my patients a lot in their kind of initial consult, because some patients choose not to put Botox in their body, Botox, Dysport, Juvederm, and Daxxify. And that's totally fine. I'm open to whatever patients want. My job as a physician is to educate you on the pros and cons, the options. And then you can decide what's best for your body. But I mean, wrinkles, we get wrinkles because of two things. We get wrinkles because of the muscles, which contract, which cause the wrinkles. And we get wrinkles because of the skin quality decreasing over time and with sun damage. So wrinkle relaxers, Botox, Dysport, Juvederm, and Daxxify are going to treat the muscles contracting, but they don't affect skin quality. So the skin quality part is going to be the lasers. So I have patients that choose one or the other. And I have patients that choose to do both as part of their kind of overall plan for their skin.
Are there any downsides to getting Botox consistently over time, where you are constantly kind of paralyzing that muscle, where it's like, okay, maybe if you've done Botox for, let's say, like 10 plus years, it could be time to switch to a laser?
I think that's controversial right now. My opinion as a physician that has done a lot of wrinkle relaxer treatments, personally on my own face, on patients' face, I don't think that there's any negative side effects of doing it long term. I think that if you only ever did Botox from the age of 20 to the age of 80, would you look as good as someone who also got a little bit of judicious filler, a little bit of laser, a little bit of collagen stimulation with some Radiesse, is it the only thing that I'd have in my anti-aging plan? No. But is it a nice complement to a holistic view of gracefully aging? Yes.
It's like a little bit of everything.
Yes.
Sprinkled in by the right person.
Yeah. And
So
I
it
mean, I
looks
think
good.
that's really important, and to have that discussion with the physician that you trust with your face, right? Because when patients come to me, I really, really want to know, what is their goal in 1 year? Like, do you have brown spots? Do you have wrinkles? What do you want to look like in 1 year? Because that's important to me, right? Because we all want those instantaneous results.
Yeah, I mean, that's the reason why you're investing the money in the treatment. You want to see the results.
But it's also important to me, what do you want to look like in 20 years? Do you want, if you're 70, do you want to look 50? Because that's a completely different trajectory than if you're 70 and you want to look 30. Those are two different aging
what would
processes.
you do differently? So if somebody was 70 and they're like, I want to look 50, well, what would you do versus the person that's 70 and wants to look 30?
So if someone comes to me and they're 70 and wants to look 30, I'm going to have a joint consult with my favorite facial plastic surgeon.
Okay.
If someone's 70 and wants to look 50, I'm going to do a fully ablative laser resurfacing on them, most likely. And after about 10 days, they'll look 50. Maybe a sprinkle of Botox or, wrinkle relaxer here and there. So that's important to me in the consult is, and getting to know my patients. Does Gracie as she wants to age, does she want to look natural? Does she want to look like, I trained in New York, so that's important because people in New York, their goal
is to look unnatural.
No, their goal is to look like they are aging better than everyone else, not because of what anyone did, but because of genetics.
Oh, okay. That's interesting. So then what type of treatments are people getting in New York to achieve
lasers, and more lasers. And maybe
lasers.
A sprinkle of those other things.
Okay.
They're doing their SPF every morning, but it's New York, there's not a lot of sun. So they're just getting lasers and more lasers because they want to have that perfect glowing skin, but they don't want to look like they've had anything done.
Yeah.
So they have wrinkles. They have, if you're 50, they're going to have nasolabial folds. That's part of the normal natural aging process. But they don't care because their skin looks so perfect.
Who comes to mind when you say that? It's not, necessarily related to New York, but a celebrity who's just aged so gracefully is Anne Hathaway.
Yeah, she looks great.
It's like she looked like she stepped into what do you call it? Like a time capsule, preserved her body and her skin for 20 years. I mean, I have not seen her look different since Princess Diaries.
Yes.
She looks incredible, but it doesn't look fake or overdone. It doesn't look so. Yeah, I guess it comes down to, like you said, the lasers and...
Yeah, skin quality is really an indicator of beauty to a lot of people. Because if you think of people that you think are really beautiful, Anne Hathaway, all these other celebrities, we're all thinking of them, right?
Yeah.
It's not that they don't have wrinkles, and it's not that they don't have nasolabial folds, and it's not that they, their brows haven't dropped a millimeter from where they were 20 years ago. It's that they have this really, really beautiful skin. They don't have redness, they don't have brown spots, they don't have under eye veins, and there's no secret to that. They just have a good laser surgeon. That's it.
That's the team.
That's really the secret, And I think having someone that does your injectables that is conservative is always just that cherry on top for sure.
That's not overdoing it. Yeah, because I'm sure you have some people that come to you and are like, I want to look frozen.
Right.
I want to look, 50 years younger, not just 20 years younger. So I guess it depends on the person. But you're right, that look where it's like effortless aging and you don't look like you're trying to not age too much, but you also don't look like you're completely aging naturally. So I feel like that's
and I think you need if that's your goal, you need someone that's going to be the quarterback of all those treatments. That's going to say, if you come in and you're like, I really want more cheek filler, you need someone that's going to say, let's hold off. Why don't we think about it? Let's do it next year.
Ag you on and be like, okay, let's do anything that you want. Yeah. And somebody that can kind of keep it real with you.
Yes, because it's not about, aesthetics to me is not about the shiny object, Sometimes patients will come to me saying, I saw this on TikTok, I saw this on social media. But, it's not about the next shiny object. It's about taking care of the patient in front of you so that they can achieve their aesthetic goals. And my practice was built on this particular, that's my niche, right? Is aging gracefully. I do have patients that want 12 syringes of filler in their face. Don't get me wrong. And, my job as a physician is to help them do that. If that's the look that they want, of course I can, technically help them achieve that. But the majority of my patients, and I'm lucky for this, they want to age gracefully. So it's just those minimal procedures, minimal skincare, a laser maybe once a year, Botox maybe 2-3 times a year. This is not something that is a lot of maintenance for my patients. And that's the nice thing about lasers is you stimulate all that collagen, you get that skin tightening, you treat the reds, you treat the browns, and you put some sunscreen on every morning. And that's it.
It's actually less effort for you in the day-to-day once
Way less effort.
Start doing the lasers. Something else you offer is vaginal rejuvenation. So can you talk about how this treatment works and why it's beneficial?
Sure. I love my women's health. My sister is a OB-GYN, so
she's going to come on too, hopefully.
You need to have her on.
At the same time.
Amazing.
I would love that.
Yes. She's such a great physician, Gracie. So we've learned a lot about vaginal rejuvenation, and we talk a lot about patients in terms of this. And she's kind of the one that got me into it because she was like, you're a laser surgeon. You should really do this because you're a laser expert. And so I started started, incorporating into my practice, and my patients love it. So lasers in the vaginal area, and I'm going to get a little technical. So if you have kids in the car, maybe, this is hit pause.
Yeah. You put your headphones in super quick. Okay.
So vaginal rejuvenation is the same laser concept as other places, right? We are doing extremely precise controlled damage to get new collagen, new skin, kind of that rejuvenation.
And is this all on the exterior of the vagina?
So it's on exterior and interior. So there are different components to kind of my way that I do vaginal rejuvenation. First, I want to know what are your treatment goals? Are you doing this because you urinate every time that you go on a trampoline or every time you laugh? Is there some urinary incontinence that we're treating? Is it a cosmetic thing? You just want you want your vulva to be tighter or, less brown or whatever the cosmetic concern is on the outside. Are you feeling, do you want like a tighter vaginal introitus and tighter vaginal canal? Is that what we're treating? And then also some of the other therapies that I offer, like platelet-rich plasma, are you wanting to have stronger or more easily attainable orgasms?
Oh, wow.
Mm-hmm. So this
you can help somebody have a more attainable orgasm through lasers.
Well, through lasers and platelet-rich plasma. Yeah, I do injections and I do some topical treatments for platelet-rich plasma. So yeah, so my younger women like it too. This is not just for my, post my moms.
Yeah.
So my younger women like both of those too. So
and what's the downtime for that treatment, and is it painful? I'm sure you numb the area completely.
Yes, we numb. You don't technically have to numb, but I don't like pain, so I don't like putting my patients through pain, Gracie. So I do numb with a little bit of, BLT. Sometimes I'll do some injectable numbing if it's for whatever reason. So yes, I laser either the outside. Sorry, let me back up. I can laser the outside, the vulva, the labia majora minora.
And that's if it's like discoloration or
discoloration. So that can help with
they...
tightening too.
Okay.
And feeling during sex or intercourse. And then you can do the interior, like the vaginal canal as well. That will help with the incontinence, tightness, all those things. And then I can also do skin tight on the outside, which is where I'm actually like tightening as well as kind of the ablative laser. So I do numbing, and it's a very comfortable procedure. I have women that kind of fall asleep during it.
No way.
Yeah, it's
lasers and they're like, okay, I'm going to take a quick nap.
Yes. It's actually not that bad. And then after, during the procedure, it just feels like maybe you have like a heating pad on in your private area.
Yeah.
And then afterwards, it feels kind of like if you've ever had like the first part of like a yeast infection or something, it can feel a little bit uncomfortable for a couple days. And I like my patients to abstain from, anything inside the vaginal canal for about 4 to 7 days afterwards.
Okay.
So
it's really not too much downtime.
It's not too bad. And, you could come, a patient could come do it and then go back to work. It's not something that you're going home afterwards and having to relax from. And one thing I will say is I was really lucky to have great kind of dermatology training, not just laser training, but also dermatology training. And I trained with someone that specializes in vulvar dermatology. So, specializes in dermatologic diseases that show up on women's vulva, the labia majora minora. Yes. And so one thing that I do before I do laser is I do a physical exam and I get kind of a whole history for the patient. And you'd be surprised, Gracie, how many times I diagnose them with lichen sclerosis or some other disease that really would be inappropriate for a laser to treat.
Yes.
They really need to treat the actual dermatologic disease. So, I'm very passionate about women's health, so I love that. So
yeah, well, guys, if you want to get some vaginal rejuvenation, you know where to go. We're going to get into misconceptions. I know that we briefly kind of touched on this earlier, but there's a few hot trends on TikTok and social media in general that we want your opinion on.
Sure.
And then we're going to get into your guys' questions because you sent in so many good questions. We honestly might have to have a part 2 so she can go into detail about all of them. But misconceptions first. Okay. I want to know your thoughts on face oiling for blackhead removal.
So I like the concept of adding oil because it helps with the skin barrier. It depends on the oil is my answer to that.
But I've seen people rub. They'll rub for like 2 to 3 minutes, so for a long time, and then you can see the actual sebum or blackheads, I don't know the proper terminology, start to come out. So is it the length of time that you're rubbing that will pull those blackheads out?
I think it's the oil actually penetrating into the sebaceous glands.
Okay.
Because blackheads are just sebaceous glands, right? They're just pores. So the oil, if you put an oil on the face, it will penetrate. There are certain acne medicines that are great acne medicines because they're formulated in an oil.
Is there an oil that you recommend for blackheads?
I love, in general, for skin, olive oil.
Really?
If I have patients that are like, I don't trust any big brands, the two things I recommend are beef tallow and olive oil.
Okay, so like extra virgin olive oil or anything? Okay, I'm going to try that.
Yeah.
I still have some blackheads that I have not been able to get rid of, so maybe that will get the job done. What are the risks of natural at-home skincare remedies? So some ones that have been on TikTok are like a turmeric honey face mask. There's like rubbing a banana peel on your skin to help brighten your skin. People have been putting egg whites on their face and then making like a mask with flax seeds. So do you have any thoughts on those?
I think the biggest risk for anything like that would be irritation and the skin barrier disruption.
Okay. But hey, I've been there, I've done it, and I can't say I had like any true benefit, so I don't know. But it's very popular. You always see people making their own masks.
It's kind of fun. Like, I wouldn't be opposed to if I had girlfriends over,
just for,
making
like,
a little
fun
flaxseed mask.
Yeah, but for daily
fun.
application, it's like, probably not the best idea.
That skin barrier can be sensitive in some people, so.
Right. What are your thoughts on ice rolling and gua sha?
So this is a good question. I like the self-care aspect of both ice rolling and gua sha. And I think there's a lot of evidence about lymphatic drainage improving the facial structure temporarily. So my sister got married a couple weeks ago in the OB-GYN. And I was like, are you going to gua sha before your wedding? And so we talked about that, and lymphatic drainage is important for your whole body. So if you take a gua sha and, you actually look at the lymphatic drainage of your head and neck, you start here, you go here, you go here, you go here, and you do that, that's definitely going to make your face look better if you have a wedding or a photo shoot or, something coming up. Whether it's going to change long term, I would argue no. And I think most people would agree with me.
So it's like temporary relief and
temporary for sure
results. Yeah. And then what's the difference between the results you would see from like your gua sha versus like a microcurrent device?
A microcurrent can stimulate, it's basically adding heat, right, to the skin. And there's some evidence that any heat can induce a little bit of that growth cascade and grow a little bit of collagen. Okay. So if you do microcurrent every single day for your entire life, would you, after 30 years of using that, have a little better skin than your twin who did not? I would say probably. Yeah, probably. But for me, I recommend to my patients finding a plan that fits into your lifestyle that is going to be sustainable over the 30 or 40 years. Okay. And for most patients, doing anything for 30 minutes a day is not sustainable. For some patients it is. But
yeah, I have the New Face, and then I also have the Zip Halo. I'll have to send you a picture so you can give me your opinion on them. I'll use them in the morning, and I enjoy it. It's almost one of those things that's like therapeutic for me.
I love that. Yeah, and I love that. Like the 15-minute self-care in the morning. Yeah. I love it. If your self-care is skincare, do it. But if it's meditation, do that. If it's exercise, exactly. I'm very pro self-care, especially for women.
Yeah. So we've talked about this briefly, but we need your opinion on red light masks. Okay.
Yes.
There's a lot of different masks out there. Yes. We don't know which one is the most beneficial, what we should be looking for if we're purchasing them, or if we should be purchasing them at all. So give us your thoughts.
So my thoughts on red light, and obviously, I've read all the science and the trials and, talked to a lot of people in the industry about red lights, is I would not purchase one personally, okay. And I would not recommend my patients purchase one. And here's why. Number one, both my parents are ophthalmologists, and I do a lot of lasers around the eye, and I'm very concerned about my patients' retina, cornea, all of these things. And there have been reports of those red light masks damaging the retina.
Wow. Okay. So your main reasoning for not recommending it is the damage to the eyes.
It worries me. It definitely concerns me.
Because I will keep my eyes sometimes open when I have the mask on. Yes. I'm like, maybe I shouldn't be doing that.
I think it's something, Gracie, that in 5 to 10 years, we're going to have a more definitive answer.
Okay.
But to me, I wouldn't recommend it to my mom, so I'm not going to recommend it to a patient. And I'm very open. If even a year from now they show that this patient has been using red light for 20 years and hasn't had any ocular side effects, then maybe I'll recommend it to my patients. But my main concerns are long-term retina damage. And number 2, does this fit into my patient's lifestyle? Is the juice worth the squeeze?
Yes.
Yeah. Do we want to spend 30 minutes per day with a mask on when we could just get one laser a year and for sure build more collagen, for sure help with wrinkles more? Those are my 2 main concerns with the red light mask.
Right, because I know, some brands will say it helps with, collagen production. It'll help with anti-aging.
Yeah.
And those were like the 2 main benefits that you see.
Yes.
But I'm sure when it comes down to a mask versus a laser, like if you know that you can get those benefits, why roll the dice and, have to put a mask on every single day?
Yeah. I mean,
potentially not
a
see
review
results.
came out, Gracie, not for wrinkles because we're just not there yet with the data. We can't do like actual good solid review papers because we don't have the papers to review yet. But a review paper came out for hair loss because, a couple of years ago, people were really touting them for hair loss. And the review paper said, so if you use a mask correctly, however many minutes per day over, a couple hair cycles, so 9 months, 18 months, something like that, on average, you regrow 1 hair per centimeter.
Oh, okay.
So like a centimeter is this big, right?
1 hair.
You're regrowing 1 hair per centimeter. And that's the best data that we have for hair regrowth
Yeah, because
masks.
that was the question people had for you as well, was the red light caps for your
Yes.
hair
So
growth.
to me, if I was a patient, 1 hair per centimeter for all of that time and money, that's something only the patient can decide. So I think, a year from now, 5 years from now, we'll have that data for wrinkles and then we'll be more educated. And if they can work out the eye things, then I will have a more definitive answer for you, yes or no.
Okay. Well, I love that. Thank you for keeping it real with us. We're going to hop into the Q&A portion of our conversation. You guys sent in like over 100 questions, so we're definitely not going to get to all of them, but we have some that were most frequently asked, so we're going to get into those. Can topical products help with hormonal acne?
I think topical products can definitely help with acne, for sure. There are a lot of good, even drugstore products that can definitely help with acne.
What drugstore products do you recommend?
I like pairing a retinol with an antibacterial product. So any of the retinols, the strongest over-the-counter one is going to be different. If you can get in to see a dermatologist and get something like a stronger retinoid, like a tretinoin or, some of the newer retinoids, something in kind of that category, and then something that's going to be, more antibacterial. So this is going to be your salicylic acid face wash, your benzoyl peroxide face wash, either of those kind of as a leave-on as well. That can help acne a lot if you get one in the retinoid category, one in kind of salicylic acid or benzoyl peroxide category.
Perfect. Most effective yet affordable skincare brand, or just skincare in general?
I would say La Roche-Posay is pretty affordable and effective.
They're at CVS and Walgreens and a lot of drugstores.
Yeah.
Yeah, they have a good cleanser that I've tried when I'm traveling and I need to grab something quick. I like their cleanser. It's good. Best treatment or product for wrinkles around the eyes.
If you are not going to get lasers and you're not going to get wrinkle relaxers, the best thing, let's say that you have a wedding or, a graduation or you're taking photos that day, is a good moisturizer. Because anything, and this is why skincare works temporarily, Gracie, is because anything that's a good moisturizer is going to help with fine lines and crepey skin and wrinkles temporarily. Because you're forcing that moisture into the epidermis, which is usually a dry layer. You're forcing it to be moist, so it's going to look better temporarily. So if you put makeup on without putting your moisturizer on, you're going to have more fine lines and crepiness than if you put a moisturizer on underneath it.
Okay.
So
this was a popular one too. Product suggestions for rosacea.
This is a good question. Rosacea is something that a lot of patients struggle with. I would say if you have rosacea or rosacea-prone skin, less is more.
Okay.
So find a good moisturizer that's not going to break you out, and find a good sunscreen that's going to help decrease the amount of redness that you get. that I would just keep it at that. I probably wouldn't even add in a retinol if you're talking about kind of general for everyone. I would just do a good moisturizer and a good sunscreen.
Okay.
So,
what is the best treatment for acne scarring?
the best treatment for acne scarring that I've found is erbium lasers, for sure. Combination, do a fully ablative, do a fractionally ablative on top of that, add in some coag, some heat. It's the best by far.
Perfect. How would you define preventative Botox, and how is it different from just going to get regular Botox?
So this is a great marketing scheme,
Yes.
Preventative Botox, baby Botox, all these things. And in general, I love social media. I love that social media has given women just the education of these are my options, even in lasers where 99% of stuff on social media is complete garbage, at least women are thinking about lasers.
Yeah.
And they, women are people in general, because of social media, they go and do their research, which I love.
Yeah, it is a great way to just do some digging.
Yeah,
and
to
learn
do
things
some
on your
digging
own.
and learn a little bit, and then always go seek an expert, which I think people now are starting to realize that,
The importance.
they're starting to hone that skill of you're an expert, you're not an expert. Does that make sense?
Yes.
And I love that for social media. That has really influenced our culture, especially with lasers. So preventative Botox, great marketing. Baby Botox, great marketing. To me, wrinkle relaxers are always going to be preventative, because even if you come to me and you're 70, Gracie, and you've never had Botox or wrinkle relaxers, we're still preventing you from going from looking like a 70-year-old to looking like an 80-year-old.
Exactly. So it's always going to be preventative.
Yeah, but my patients that are in their 20s, early 30s that necessarily don't have wrinkles, Botox is a great thing to start, because we really are preventing those wrinkles from forming, because you're not letting those muscles contract. But you have to change the skin quality, like we talked about. You have both.
What
Yeah.
about, this is a question for me, your favorite treatment that you've done on yourself or had done, or one that you feel like has been the most effective for your skin?
So my sister practices with me, and she's also a dermatologist laser surgeon. And last Thanksgiving, I took a week off of work and did the eye rejuvenation procedure on myself. And I can show you some before and afters.
I would love to see them.
Because, I'm 36 now, so I was 35 at the time. And I was starting to see a lot of the aging process around my eyes, some of the crepey skin, some wrinkles that, Botox was not treating, especially kind of right here.
Yeah, I have a little bit of crepiness on the inner corner of my eye.
Yeah, and I was starting to see kind of the blue under the eyes more than I had 10 years ago. So I asked her, I said, would you pretty please do an eye rejuvenation procedure on me? And she did. And I loved it. I loved the results. It gave me so much confidence, because now I don't wear makeup most days. I might throw some mascara on just because I'm like super blonde and have no lashes if I don't. But it really kind of gave me the confidence to go out there and, feel good in my skin.
What is the best method to reduce or get rid of hyperpigmentation?
You have to find out what's causing the hyperpigmentation.
Okay.
That's the most important thing, because is it melasma? Is it sun damage? Are they seborrheic keratoses? Are they lentigos?
That's what I have, the seborrheic keratoses, right, on my legs.
Yeah, so
Okay.
you have to find out what's causing it, not only to treat it, because it's important to, let's say you are looking for an even over-the-counter treatment or a laser, you have to know what it is so that you can choose the appropriate treatment. But you also want to know what it is because you want to prevent it in the future. If we talked about this in your consult, seborrheic keratoses, how to treat them, how to prevent them moving forward. And that's really important, because if you have melasma, you're going to have a completely different treatment plan than if you just have sun damage or if you just have seborrheic keratoses.
Right, so you want to understand the cause before you decide what treatment you are going to get. Okay.
Yeah.
Best pre-wedding treatment for glowy skin. All of our brides want to look beautiful on their special day.
Yes, I love my brides. They are such, it's just such a joyous time in women's life, and I love treating brides. So I would say a year before, we're starting lasers. And
Wow,
that
a whole year before.
Yes. Okay. Yeah. So when you get engaged, come and see me, or come and see a laser surgeon.
First thing you're going to do.
If you have any concerns, you
Yes.
know, and that's when we start treating reds, treating browns. You know, do you need an eye rejuvenation procedure? Do you know, what is your plan between now and whenever your wedding is? And this goes for mothers of the bride too. I have a lot of mothers of the bride that
everybody wants to look good.
Yeah.
Yes.
But then the day before, or the week before, I'm giving them my cell phone number and I'm saying, if you break out with acne, you need to call me as soon as you do so that you don't get acne on your wedding day. You know, a lot of brides are very stressed. So that's when we're putting people on kind of the oral medicines to treat the acne. And then my favorite procedure to do before a wedding, a red carpet event, etc., is to microchannel some platelet-rich plasma into their skin. You can kind of think of it as, have you ever had a facial?
I've had a hydrofacial.
So yeah, so you know your skin was glowy for about 12 hours afterwards, and you're
Yes.
like, this is amazing. I wish this could last forever.
Exactly.
So microchanneling the platelet-rich plasma is kind of like that, but on steroids, because it lasts for about 2 to 4 weeks afterwards, and you're really kind of inducing a little bit of long-term collagen growth as well. So I love my microchannel with PRP for my brides, red carpet events, etc., kind of within the week of the wedding.
Okay, so that's closer to the event. Perfect. BBL versus IPL. Give us the pros and cons.
Okay, so this is a good question. IPL was the first one that was invented, intense pulsed light. So intense pulsed light, and sorry, this is going to be really sciencey.
We love that.
It is a flash lamp that emits a range of wavelengths, okay? So you're going to get a range of wavelengths as opposed to a laser, which is one wavelength. You know, when we're talking about acne, we're talking about 532. You know, we're talking about resurfacing erbium, that's 2940, you know, CO2, 10,600. IPL and BBL, it's going to be a really, really strong light bulb, basically, that emits a range of laser wavelengths, which is good because you're going to get a little bit of red, a little bit of brown, a little bit of collagen, and then they're filtered.
Okay.
And the difference between IPL and BBL is just the newer technology. But I would say whether you're getting IPL or BBL, BBL is going to be superior technology, but the most important thing is who's doing it. Because if you're not an expert at doing IPL or BBL, it is the most litigated device on the market, and it has the most complications of any other device on the market because there's such a small therapeutic window, which means if you undertreat, you're not going to get any result. If you overtreat, you're going to get scarring, burns. A lot of the social media complications of lasers are IPL and BBL. So
that's when you're seeing those horror stories of the permanent scarring and
some
damage.
of them, yeah.
Okay. That's a great segue into the next question, which is how do you find a good dermatologist for these treatments?
So this is a really good question. So my recommendation is always going to be to find someone that's a dermatologist, so a board certified dermatologist. You know, they're going to have an MD behind their name.
Okay.
They're going to be boarded by the American Board of Dermatology. And then if you can find someone that did a fellowship in lasers and cosmetics, that's going to be your laser and cosmetic expert.
Okay.
You know, there are great dermatologists who did not do a fellowship, but they just have a lot of practice. But my recommendation always is to find someone who did a laser and cosmetic fellowship through the American Society for Dermatologic Surgery, who runs the fellowships. The problem with that, Gracie, is there's only 125 of us in the United States that are practicing.
Insane.
Yes. So there's 125 of us, which means that there's one of us for about every 2.7 million people. So we're hard to find. But because I have so many patients that asked me this, I made a website that's like a very bare bones website. And basically the only thing on it is a list of all 125 of us.
We will be putting the link to that in the show notes so everybody can go and see it. Thank you for doing that.
No problem.
But that's crazy. There's only 125.
Yes. Practicing
across the US.
people, yeah. Because a lot of people that did a laser fellowship, they get pulled to industry and they go work for laser companies or skincare companies.
Right.
So, you know, I tried to, and this was something that my staff and I did during the hurricane. We were closed recently in St. Pete for a couple weeks because of the hurricane. And so we decided, you know, what can we do for our patients while we're closed? We can't see them, we can't run our clinic, but, you know, we get asked a lot, what can, you know, our patients that have friends in Chicago or are moving, who can I see? So I was like, well, I'll just figure this out. It can't be that hard to make a website. So I went on, Website Maker, and I figured out how to make a map, and it was really fun, and my staff helped me kind of find and call the offices, make sure that they were still practicing, they had lasers, etc. So
right. Oh, wow. That is so amazing that you did that. Everybody go and look at the link that we have in the show notes if you're interested in seeing that list and you can't come to St. Pete to see Dr. Kesty. Last question is just, I know that you talk a lot about like your self-care and you love having that time to yourself. Is there anything in your routine or like best of 2024 favorites or anything that's brought you like a lot of joy or you just feel like has improved your overall wellness this year?
I would say the biggest delta for me, Gracie, is looking people in the eye and actually spending time with them and just focusing on who's in front of you at that time. Our lives are so busy. I'm a mom, I have my practice, I have my side gigs, all these things that my life is very rich, and I'm thankful for that, but it can be busy. And so one thing that I've really focused on in 2024 is when I'm here with you at this podcast, I don't have my phone on. I'm not thinking about, my kid or my office or my patients. I'm just thinking about you and how I can best kind of serve you and your listeners. And same thing when I'm with a patient in a consult. My 100% focus is on them. And I'm with staff and I'm training them. My 100% focus is on them. Same with kid. When I'm doing my meditation, when I'm working out, So it sounds simple, but it's really been something that I've been focusing on this year, and I've really enjoyed it, and it's paid dividends in so many areas of my life and just made my already, I love my life even more rich. So I love that question.
That's
Thank
great.
you so much for asking that.
Yeah, of course. I think I talked about this in one of my solo episodes, but a regulated nervous system and being able to be present and be still in a moment when you're with somebody, whether it be your kids or somebody that you've just met, or let's say it's a meditation or your workout, to be fully immersed in the moment and to be focused is like honestly a gift. And it's hard for a lot of people to do. And unless you know your stress triggers or unless you can like not focus on your breath and just be in the moment, like it's easier said than done, but it does. You get to enjoy the moment so much more. You're present and you just get more, out of life. So I love that you're embodying that, and that's been your delta for the year. Tell everybody where they can find you, how to book an appointment with you, where to follow you on socials, all of that good stuff.
So if you Google my name, Kat Kesty, I'm very, very easy to find. Okay. It's a very unusual name, but my clinic is called St. Petersburg Skin and Laser. I practice with my sister, who I love. She's also fabulous and, great at injectables and lasers. And then I have kind of my socials at St. Pete Skin and Laser.
Perfect. So. Yeah, so I'll bring you guys along the journey because I'm pretty set that I'm getting the laser. What laser are we doing on my legs?
We're doing a combination.
We're doing a combination laser on my legs. So I'll walk you guys through that process so you can kind of see how it goes. I'm nervous, but you guys know, especially after listening to her, that I'm going to be in good hands.
And Gracie, I have to interrupt you.
Yes.
Forgive me. Because
go ahead.
I just think your podcast is so amazing. And I love the name Wellness Her Way. And I just resonate with that so much because there's so much out there about wellness and skincare and lasers and, all the other topics that you talk about. And I love that you're empowering your listeners to do it their way.
Right. Oh, well, thank you so much. So. You guys also, if you're watching this on video, she made me a friendship bracelet that has like Wellness Her Way on it in my initials. And it's just like the sweetest thing that honestly anybody's ever done for me before an interview. And it's like my little interview good luck charm. So now she has to come back on for a part 2 so I can make her friendship bracelet. So when you see her next time, we'll have our bracelets on together.
So sweet. Thank you so much.
But I think life has such a interesting way of bringing people together, and I'm so happy that I booked that consultation and got to speak with you. And there's not a lot of people in the space or dermatologists in the space that are willing to have that open mind, but also you want what's best for your patient. You don't want to be the dermatologist that's just like pushing your own agenda or giving people a treatment just because they want it. And you just have such a beautiful way of educating us and communicating. So thank you so much for coming on. Hopefully next time we can have you and your sister and we'll do like a little duo. But yeah, you guys, everything's going to be linked in the description so you guys can go and follow her. And yeah, we didn't get to like half the questions, so she's going to have to come back on so we can get to the rest. Okay. Thank you.
Thank you so much,
guys.
Gracie.